Hello and welcome. I wanted to discuss an interesting research paper that was published recently that was on optimizing the delivery of genetic and advanced diagnostic testing in Ontario. The results of this research may be used also as insights for other jurisdictions in the United States, in Europe, and in Canada, across all of the provinces. But more importantly, it really gives us insights on how we integrate and adopt new technologies that are potentially disruptive or different in our health systems. And so this research and this paper clearly also elucidates some of my research from 2006 to 2022 on leadership and decision making and some of the impediments that we currently have in terms of the people that we choose to do these decision-making models, or also the opportunities we have for integrating people with strategic foresight, which is an innate gift, and a sophisticated brain system that is very rarely found in persons or in humans specifically. But there are frameworks for foresight planning that can be used to get people out of groupthink mentality and to develop a futuristic and anticipatory planning perspective. So this is interesting research because it actually shows how we can apply HTA in a model of strategic foresight for futuristic planning. The findings from this great research paper, and I will mention the names of the scholars at the end, suggest that there are unique challenges of adopting and managing complex health technologies that require significant upfront investment within a healthcare system that has decision-making that is highly decentralized. There are also several important implications for the role and the function of health technology assessment, and health technology assessment frameworks need to acknowledge, according to the research, the role of testing in knowledge production and its benefits beyond healthcare decision-making in the present time, or in a short-term plan of 3 to 5 years. Given many HTA processes are restricted to health systems, budget holders, and decision makers, this may not be a way to integrate early adoption of key technologies in the future. Specifically, this looked at the barriers to the integration of genetic and advanced diagnostic testing in Ontario. So what we found is that the optimal delivery of an advanced diagnostic testing service environment revealed a number of challenges along the continuum of health technology lifecycle decision-making. Now, none of these challenges allegedly may relate myopically to resource availability. Instead, they emphasize the important role of care, organization, governance, financing, and HTA that allows for potentially disruptive and costly technologies to be integrated in and adopted and managed in our health systems. While these recommendations may be specific to Ontario, Canada, they do serve as clearly insightful for futuristic planning on the recognized challenges of generalizing to other jurisdictions new technology introductions, which could even include machine learning or any other biomed technology in any health system. Now, the people that are responsible for this excellent research and the references below, as well as the article, are Don Husereau, as well as Terry Sullivan, Harriet Feilotter, Marcia Gomes, Rosalind Juergens, Brandon Sheffield, Shaquille Kassam, as well as Tracy Stockley and Philip Jacobs. Now, I will be doing some videos of health technology assessment research. So if you have something that's interesting or in the medical field that you would like me to summarize, as about all of the content right now for information, about 81% is in video format. People are simply not reading any longer. And this type of research allows us to understand the barriers to patients receiving timely and equitable access to testing in Ontario specifically. However, it can be overlaid or is transferable to other jurisdictions. And also the lack of clear mechanisms to identify future needs, adopt, and also reconsider existing technology and provide oversight and coordination for the province, but also this can be transferable knowledge for other jurisdictions. Now, I have spoken previously about the importance of strategic foresight. And so it doesn't matter how many people you have in decision making for new health technology assessments or horizon scanning for where the benefit or the cost consequence lies. If you do not have someone on your team that has this advanced and sophisticated skill of brain development, then you may fall short and become unprepared for the future in uncertainty, pandemics, and wars. As I've mentioned, someone with strategic foresight is someone that not only has a highly developed area of the brain for strategic foresight and seeing these risks and opportunities ahead of time, but they also draw on complex thinking models based on intelligence, which include domains of systems thinking, management sciences, sociology, data sciences, predictive analytics, cognitive and developmental psychology, and creative thinking. And my master's research looked at the development stage progression of humans, specifically at what level they're on and their ability to assess and use complex thinking models of intelligence to assess the present moment risks in uncertainty and unprecedented change, and then to plan and see the opportunities based on where the marketplace is moving. Now, in health systems, we're looking at patient health outcomes, managing sustainability of health systems based on population demographics, morbidity, and mortality risk. And so strategic foresight in health technology assessment and finding people specifically with this skill or that can build in the frameworks for your decision making and your teams so that you are not blinded by cognitive biases or by the need to see reality based on sort of your happy place based on cognitive biases. And there are very specific frameworks that I've developed for doing this in groupthink mentalities where there can be and there always are cognitive biases.